Smoking is injurious to health, it causes cancer. This statement is as well known as a nursery rhyme. Also, it's true. 8 million people die every year because of smoking, 7 million of them because of direct tobacco consumption. The remaining 1 million because of passive smoking. Clearly, cigarettes are not good for you. But some studies beg to differ. And a lot of them have come out over the last 1 year. They suggest that smoking helps in fighting the Wuhan virus or COVID-19. This one, for example. Do you see what it says? Smoking is associated with a lower risk of developing COVID-19. Another says nicotine might reduce the risk of severity of contamination. This study says smokers have lower probability of developing symptomatic COVID-19, meaning even if you're infected, you will have no serious symptoms. There are also studies linking smoking to lower hospitalization rates, meaning if you smoke, you'll most likely not end up in hospitals. And I know these are hard to believe, but listen to this one. In April 2020, the Daily Mail reported that 28 studies have shown lesser number of smokers among those hospitalized. 28 studies. You must have read about them or at least heard about them. If these studies are to be believed, smoking is good for you in this pandemic. But how are these studies arriving at this conclusion? On what basis are they selling nicotine as a therapeutic option? Or for that matter, presenting such convincing numbers in favor of smoking. Look at this one. Smokers 23% less likely to be diagnosed with COVID-19. And by the way, all of this contradicts existing data. It has been proven that smokers are 5 times as likely to develop influenza and twice as likely to have pneumonia, which, by the way, is also a lung problem. Just like COVID, it infects your lungs. It doesn't add up, does it? We'll tell you why. Because these studies are sponsored by companies that sell tobacco. And the World Health Organization has issued a clear warning: do not fall for such studies. The harms of tobacco use are well established, and we all know that. But when falsehoods are presented as scientific data, what do? Who do we trust? The so-called experts or our guts? Hello and welcome to Gravitas Plus. I'm Palki Sharma and I'm here to tell you to not trust studies blindly. First of all, they have biases. Towards whom? Their sponsors. You see, research is expensive. It needs time, energy and money. But sponsoring a research is not always philanthropy. A lot of times, sponsors do it for profit, for pushing a conclusion or narrative that favors them. In this case, the tobacco industry. An article linking smoking to lower risk of COVID severity was recently taken down by the European Respiratory Journal. The journal said 2 out of the 5 authors had financial ties with the tobacco industry and they had not disclosed it. FYI, the tobacco industry is worth $932 billion. It is expected to touch $1,073 billion by 2028. $1,073 billion. How will the industry reach this height if people stop smoking out of fear of COVID complications? In 2018, tobacco companies spent $9.06 billion in marketing their products in the United States alone. That's roughly $25 million a day or $1 million every hour. Can you believe it? $1 million an hour on marketing. So will you now believe me when I say the tobacco industry also pushes favorable narratives in markets when deemed necessary? I want to take you back to the Daily Mail headline, the one that talks about 28 studies linking smoking to COVID prevention and severity, etc. Do you know where these 28 studies were conducted? In which markets? 22 of them were conducted in China. China also just happens to be the world's largest producer and consumer of tobacco. 1 in every 3 cigarettes smoked in the world is smoked in China. In 2018, China's tobacco industry made around 929 billion yuan. What about the rest of the studies? 3 of them were conducted in the United States. The US also just happens to be home to Philip Morris International. It is one of the leading players in the global tobacco market. This is a company with a murky history. In 1970, Philip Morris bought a research laboratory in Germany. In 1972, it organized a conference to generate public opinion in support of smoking. In 1988, it formed the Center for Indoor Air Research, CIAR. The mission was to quote-unquote create a focal point organization of the highest caliber to sponsor, and I repeat, sponsor and foster quality objective research. When the CIAR was disbanded, Philip Morris recreated an external research program with a similar structure. In the past, the tobacco industry has also funded papers to discredit studies that link smoking to cancer. Here's one example. In 1981, Takeshi Hirayama published a study associating passive smoking with lung cancer. It's one of the most popular studies on second-hand smoking, and it is often cited in research and in courts of law. But do you know how the tobacco industry counters the Hirayama study? By citing studies like this one, the Japanese spousal smoking study. Do you know who conducted it? A tobacco industry law firm. This is called manipulation of science. And it is not just limited to the tobacco industry. In the past, Coca-Cola has funded research that said physical activity is more effective for weight loss than cutting down on sugar-sweetened beverages. Meaning, if you want to lose weight, work out. Cutting down on soft drinks will not help. Then we have a beverage company called Pom Wonderful. It paid $35 million for studies that showed their drink reduces heart disease and prostate cancer. Agricultural biotech companies have paid for papers defending genetically modified crops. The dairy industry has paid for a study that concluded meat and cheese are sources of good cholesterol. The alcohol industry funded studies that say red wine is good for your heart. You must have heard that. Or studies that link moderate drinking to a longer life. The oil industry has tried to downplay the threats of climate change, citing research. This is called a funder's privilege. And this is one of the many reasons why you cannot trust studies blindly. Here's why else you should not. Most studies today have a small and biased sample. For a study to be globally relevant, researchers must include participants from across gender, age, nationality, race, and socioeconomic levels. But most studies these days rely on the so-called WIORD samples. That's an acronym, WIORD, for Western Educated, Industrialized, Rich and Democratic Societies, WEIRD. A review of articles on psychology journals published between 2006 and 2010 found that more than 90% of the participants came from Australia, Canada, Europe, the United States or New Zealand. So participants from Africa, Asia, Central and South America and West Asia were reduced to under 3%. So when a study says mental health issues are on the rise among adolescents and young adults, it may not be totally applicable for a country like Bhutan or say Finland. Because look at this study, it only relies on data from a survey conducted in America. Here's another problem with research papers. They muddle the truth with complicated words. It's called obfuscation. So let's get one thing clear. Research, studies, papers, they have all been fabricated before. Scientists have even lied about evolution. In the year 1912, Charles Dawson claimed to have discovered the missing link between man and apes, the link of man's evolution from apes. And he based his study on a human skull he found in Piltdown in England. Turns out, Charles Dawson may have combined a human skull with an orangutan's jaw and the teeth of a chimp to prove his theory. Unbelievable, right? But that's the point. Be it a study on smoking, cooking oil, red wine, or breast milk versus formula milk, this is what we say. Take everything that comes your way with a pinch of salt.